Hello, everybody. Welcome back to another episode here. So today I'm thrilled to welcome Dr. Joshua Engel, MD. He is a primary care physician, Medtech entrepreneur, and a true innovator in the world of digital first healthcare, as well as a graduate of USC Keck School of Medicine. Now, he has an extensive list here. I want to introduce you and let you tell the viewers more about yourself.
Yeah, so just to hop in, just like you said, graduate of the Keck School of Medicine, did an intern year at Loyola McNeil, and then from there actually did post-doc training at Beth Israel. I've started with UMD. We basically are a primary care focus that has two specific niches. One is on chronic care management, which I think will be the most applicable for this call, and then also we have mental health services as well.
Wonderful. Thank you for sharing. And so you reached out to me through Instagram, and I'm glad you did. We're looking to connect with more professionals. As you know, our focus here is addressing the problem that is affordability here in healthcare. Now, I
Mhm.
understand you are also the CEO of With You MD.
Yes, that's correct.
Wonderful. Can you share a little bit about what the work that you're doing with You MD?
Well, I think the biggest thing for this call is actually on the chronic care management side. And so with that, think like primary care, but also like we are really working with patients on a much more hands-on perspective and not just, focusing on the medicine side, which is absolutely critical, but really connecting them with the resources they need as well.
Wonderful. And before we dive into everything, would you like to share maybe about how, where you're from and a little bit of story about how you got into this field and how you got into, helping the world in this area?
Yeah. So originally from California, and we went into a little bit about my background. I think the it's interesting because the problems that I end up addressing through the practice and otherwise, in a way, they choose me. Because one of the things that I noticed is that in a traditional primary care practice, there are they do a really good job on the medicine piece, but they're don't focus as much on the actual bridging the gap with patients and resources, for just because that is such a big determinant of health that I knew I wanted to really have that be a strong focus in my practice. And so, there's, like I said, there's something called chronic care management. It's a system that allows you to where the incentives are actually aligned with connecting patients with resources as opposed to the other way around. And so that's just it's a way that I've built my practice from the ground up.
Wonderful. Wonderful. And what are some of the bigger problems that you're noticing in chronic care practice?
Yeah. So really it's the affordability of healthcare, is a really big thing. And that's why your content and reaching out to you was something I really that resonated with me and something that I wanted to do. Because you just see how astronomically expensive, even for patients that have insurance in many cases, healthcare can be. And so, like looking at all the resources out there that, quite frankly, I wasn't trained as a physician to knew existed, and patients wouldn't think to look for. That's something that I want to, first of all, do continue to educate myself on, but really spread the word, just so people know that these resources are out there.
Are there any like chronic care conditions that you focus on specifically more so than other ones?
I would say that there's a lot on, so it's more folks that are elderly, have like a lot of mobility issues. So, like looking at everything from giving connecting them with like durable medical equipment, which are things like wheelchairs, canes, that sort of thing, to getting them the support that they need on the dietary front for like a lot of these folks, because they have mobility issues that snowballs into metabolic issues as well, like diabetes and that the type of thing. And so looking to get them connected with a lot of nutritional training is another thing that we help with, for example.
Now, I know one of the raves are about the medications like Ozempic and Wegovy. Now, I believe
Hmm.
you've written about these trends and how they fit into this broader CCM strategy. Would you like to share a little bit about that?
Yeah, so these are, it's funny because everyone's so polarized about these agents. I just think a little bit being a bit more stoic is in order. If you have, so just to talk about the medical piece for a bit, if you have diabetes, if you're clinically obese, not just you want to lose a little bit of extra weight to look good on the beach, but really clinically obese, these agents can be useful. And in my opinion, the juice is worth the squeeze there, just because like you look at just all the health complications that go along with poorly controlled diabetes, that go along with obesity. So in those situations, these agents should absolutely be considered. um, an area that I do have some concern on is for people that are not chronically obese that are using these agents. Not only are they, just limiting the supply or for folks that do need these, that's becoming less and less as a problem as, the supply of these agents are ramping up. But there's no free lunch in medicine. And so this is something, and one of the things that you've noticed, or we've noticed, that I'm sure you've heard about, is that there is a risk of muscle loss, but with these agents. But what I find concerning, more bone loss. So just because you look at especially folks that are a little bit older that don't have a great bone reserve to begin with, um, that's an area of concern. So now, listen, this could be a half an hour conversation about whether if you do weight-bearing exercises, is that going to be something that fully mitigates that? It could be, there's discussions as to whether or not, no matter what, like when you lose weight, you lose some bone and muscle mass. So there's discussions of like, okay, is this something truly above and beyond that? So there's all these sorts of things. But like I said, I just keep coming back to the fact, no free lunch. So, if you're just trying to lose a little bit of weight, just lifestyle interventions. But but the flip side, if you are clinically obese, have diabetes, like that's what these agents were made for. And we shouldn't demonize folks that want to use GLP-1s, Wegovy, Ozempic, just that could really benefit from these. So that's a little bit of my rant on the medical side. Now, affordability is the other side. So that's something where you just see how expensive these medications are out of pocket. Um, and the challenging thing is that while some insurances do cover them for obesity, Medicare and Medicaid currently doesn't cover it purely for obesity. You have to have like a diabetes diagnosis for it to be covered by Medicare and Medicaid. Um, a few things just to look at. Number one is the price of these agents are trending down just as more competition comes out, and just there's like I'm sure you saw there's even oral versions of these things that are just hitting the market. So that's something to keep an eye on. Other things to just advocate for is, once again, not applicable for Medicare and Medicaid, but if you get it covered by insurance, but you still have a large copayment, typically there is a copayment assistance program, that a lot of these insurance companies, or sorry, that the manufacturers will offer if you Google, the name of the medication, comma, copayment assistance. That's a way to go. And then there are still somewhat expensive, but less expensive. There are these direct programs where you can just the manufacturer will have, like, for example, Lilly Direct is something to look at for affording these medications. I think it's going to be a short term problem. I think overall the prices of these medications will continue to come down. But yeah, in the short term, Medicare, Medicaid, unfortunately, not for straight obesity for these medications. So sorry, I know that was a little bit of a rant there.
No, I look, I want you to rant. I mean, we want to
Yeah.
hear your
One
side.
one thing I do want to just advocate for in general, though, apart from Wegovy Ozempic, is that typically, like a lot of the manufacturers, first of all, they'll have co-payment assistance, and I know that may not seem like a big deal, but I've literally had patients where they've got like foregone their Farxiga medication, which is like a diabetes CKD medication, because of not just of the out-of-pocket price, but because of the copay. And so they have strong like a copayment assistance program. So if you're ever running into challenges with the copay, Google like the manufacturer of the medication, comma, copayment assistance, and that could be a good way to go. Also, a little known thing is a lot of times, like the manufacturer, if it's if you've received a true insurance denial, a lot of times they may even have a charitable or supplemental wing that will just give you the medication at cost or at free. This is something that's personal to me. I have like a medical condition called inflammatory bowel disease, and even though my care is led by I have the good fortune of seeing literally the lead of the Crohn's and Colitis Foundation as my physician. So to say that he has more expertise than whatever is, just on the other side of that table would be an understatement. And we agree that I should be on this medication called Rinvoq. The insurance, for whatever reason, denied, obfuscated, and just we appealed multiple times. They even had denied. A lot of times you can do a what's called a peer-to-peer to actually fight, like insurance companies, or just get kind of like one last go at getting it approved. They wouldn't even do a peer-to-peer. They just don't even have that process. Um, but what I actually learned is that, the manufacturer of Invoke, for example, has a program where if your insurance actually firmly denies for at least 24 months, they'll completely send you the medication free of charge.
Hmm.
So that's why I wanted to bring up that story, is that a lot of manufacturers won't necessarily have a completely free program like that, but they'll have a program where if your insurance company denies, the medication, you can at least get it at a significantly reduced rate from them.
Yeah, and again, that's our big focus. Now, we are not, so I'm not licensed in New York, and I don't know exactly how insurance works in the state of New York. All the states are different. I believe it to be a little bit more limiting, but this machine as a whole is quite grand. And to say that would just be, me speaking from probably misinformation or being uninformed. What kind of problems do you see in the insurance world when it comes to working with either yourself as a patient or working with your patients?
The problems I see is that they've figured out very blissfully that they can just offshore their customer interface to just overseas. And then, they'll just have it so you can't even get to the appropriate party to begin with to actually have a discussion about your care. So you're either left yelling at some poor lady who's earning, like $8 an hour in the Philippines, or just, just going somewhere else and not even bothering. So I think that that was probably something they originally did just to save money on their customer care representatives. And then we're like, oh wow, it turns out we actually don't have to, have like people just drop off, and we don't actually have to service these folks if we just don't really give them a pathway to complain.
It's heartbreaking to hear. This is thinking 10, 20, 30, 40 years down the line. My parents are getting older. I'm getting older. These are fearful topics that they create fear for me. And that's part of the reason we're doing what we're doing. So we don't have to live in that world here into the future. But it is a big monster. We're very ambitious in our goals, but I don't really know if people try. Well, you're of course trying. And I think this would be a good segue to speak about with you, MD. I love technology. Technology has proven to be deflationary over time, and you have shown just through this conversation as well that these agents are getting cheaper as more competition is available, as well as I'm sure it's easier the supplies get bigger, they're easier to produce, they get cheaper to produce, and so forth. We should be seeing declines in prices, but medical costs, from my gathering, has increased 200, 300% over the last several years.
Yeah.
And it's one of the highest increasing cost industries across all industries. So can you share maybe a little bit about what you guys are doing with UMD on addressing the affordability problem?
Yeah, I mean, so two things. First of all, we're going, if you're, so we take Medicare, we're actually a hybrid practice. So we take Medicare, Medicaid, but then don't take any of the other commercial plans. Like the rest of our practice is what's called like direct to patient. And the reason I wanted to set it up that way was for people that literally have like no choice, have Medicare, Medicaid. And when I say Medicare or Medicaid, I mean also all the Advantage plans that go along with that. Um, the like for folks in that system, it was important to me as a physician, like, hey, like these folks are the folks that need this, our help the most. This is like why I went into medicine. Like I get that insurance companies are frustrating, but let's not punish them. Like let's work with them and take their insurance. And then on the other end, we're just setting like a reasonable monthly premium. It's literally like $50 a month to be like a patient. And then, that way the care is between us and the patient and what they think is best. And you're seeing that more and more. And I've even been looking at some interesting solutions because the fear is like, okay, you have a direct to care provider, but then what if something catastrophic happens? You still need like insurance, right? But then I've been looking at some innovating things that have platforms that have been getting hospitals on board as well to kind of be part of like this just entire network. So that you don't have to worry about necessarily the catastrophic care problem, and you can have a direct to patient care approach, with your medical practice. But anyways, for us, going back to us, I would say that that's how we navigate the by being thoughtful on how we actually set up the reimbursement. That's one way. And then, as you alluded to, technology forward approach. Like, yes, we do have like a location that we can use because like some things you just absolutely need to do in person. But like it's literally like a WeWork of medical locations. So we
Hmm.
only rent it when we need it, and then because of that, our overhead is much less, and we're able to that translates into the once again the monthly just re subscription that we can charge our patients. That brings that way down because of that.
Very good. Do you find yourself doing more in person or more virtual now?
Definitely more virtual.
More virtual.
Yeah.
And do you think, I mean, do
And
you,
and and sorry to interrupt, it's not just like a financial decision. It's also what the patients want. Like, who wants to take a half an hour out of their day, forego the work, just fight traffic, like
Mhm.
then wait 45 minutes in a doctor's office, like with a screaming kid in the background, and then have then go another like half an hour back to work and try to play catch up. Like this is, like expanding virtual care is a big thing, and especially not just and that's in areas where you have a doctor's office that's really close to you. If you think about rural areas, that just don't have doctor's offices near them, this is a big piece on how you can solve that. And so, and that's why I think it's our duty as physicians to be very well apprised on the telehealth innovations that are coming out. So like for example, an article I wrote was looking at a technology called remote flow tomography, which is you can use your cell phone, camera to get a full set of vitals on a patient. Still not quite ready for prime time yet. Still has some more R&D to do, but that's coming and it's right around the corner. And so you could easily see that being incorporated into like a ZocDoc platform where, just where when you see patients, you're getting like you're able to trend blood pressure over time just through those visits, just using their cell phone camera. And that could go, and you look at like what that could mean for rural care and like expanding the access, just into those rural environments. So I think that telehealth, yes, as a science nerd, I just naturally gravitate towards it. But I also think just as part of being a good provider, it's your duty to be well educated on telehealth and all the developments in it.
Wonderful. And I love technology again.
Yeah.
As a user, or for let's just say for yourself, do you find yourself implementing or using more AI? Because as I continue my effort, AI is being implemented more and more so into my business, whether through research, through content, AI generated stuff. Can you share on that?
I think it's at this point it's on the back end mostly. So, like so first of all, so if you I would say more on like the MLN type front, like there are some more tailored like MLNs for like medicine as opposed to just your generic chat GPT, for example. So those are coming, and I've seen that. In terms of AI, obviously it's no surprise, and we've heard it for a while that anything that's vision based AI is really doing incredible things, especially in the realm of radiology. They can just see these just intricate shades of gray that just the human eye just can, and detect things a lot earlier. So in the realm of radiology, there's a lot happening in AI. Um, you are getting some interesting pilot cases. Like I just saw a news story about an AI chat that can not only diagnose but can actually prescribe refills of medications.
Hmm.
So listen, I have safety concerns on that, but I think that'll be interesting to see where that goes.
I mean, I couldn't agree more, and especially going back to the affordability problem, we do have technology that can be more successful at a higher success rate and they can move quicker. We should be again seeing these deflationary tendencies across costs in healthcare. So I am excited on the cost front, but I do see, I mean, I'm doing research all the time. I do see some scary things coming out too with it, but time will tell. Time will tell about that area. Now, if I'm a patient and I want to work with you and I want to be a part of your subscription, as a regular guy, can I just sign up with you and start working with you, or how does that work?
Yeah, I mean, we're based in New York, so state licensing laws, you got to be in. It's actually where the patient is based, so you got to
Okay.
be based in New York. But apart from that, yeah, you're more than happy to work with you, provide care. It would just start with just a basic patient intake. Of course, we would be willing to work like virtually. Just tell us what brings us to you. or brings you to us, I should say, and what your health goals are, and then we go from there. And we have contracts with, for example, like Quest. So like for labs, wherever the closest Quest is to you, that's a place that you can get like your labs done. And yeah, that would be the general process. A few things that, just because I really every breath I want to be able to give people value and like hopefully just point people to some programs they may not know exist. At least in the state of New York, there's a program called the CDPAP program. This is a program that allows you, if you're caring for someone in your family that has a disability, it allows you to receive a stipend for providing that care. And so that's something where, like the only limitation, for whatever reason, they don't like spouses doing it. I guess too many people were gaming the system based off of that. But you can literally be anyone else. You can be a friend, you can be a kid, child, son, daughter. I don't know why it took me a while to come up with that. And you can just enroll to be like their official home attendant through the CDPAP program and get a stipend. There's also, in the state of New York, there is a fresh produce for seniors program. It connects farmers markets with seniors. That's just so for folks that, their food banks just aren't filling in that gap enough. That's actually something to look at, once again, this in the New York area. And then, I'm sure a lot of folks are familiar with the WIC program, Women, Infant, Children. That's something where they provide a lot of great support. So, I appreciate you giving me the opportunity to talk about with UMD, but I really want to make sure that, folks are aware of some of these other great programs out there. Just because I really want to make sure that we do everything in our power to address the affordability around healthcare and all the adjacent, and around nutrition, because that's really something that is just such a big determinant of health.
Absolutely. Absolutely. Is there any other avenues that you think that you can think of or that you could share with our audience to let them know about the new advances or the affordability stuff that we're addressing, the programs that are available, or avenues for people that are struggling to get decent health care?
This may seem like such a lame answer, but I promise it's going to be fruitful for you. Literally, just like go into ChatGPT, type in what your problem is, and type in what programs, like what government sponsored programs are in my area that could be relevant or could, just could help with this problem. You'd be amazed at how often sometimes it'll come up with a specific answer and, point you in the right direction. Oh, and another thing that I just want to point to, once again, just like putting out all the programs I can think of. Most people are familiar with this. They're accessoride, New York area. It's transportation for people that have disabilities. They'll actually come to your door. It's like a small bus. They'll bring you to doctor's appointments, and in many cases, non-doctor appointments as well. It's not perfect. It's not as convenient as Uber. I want to set expectations. But that said, for folks that need it, that's a good thing to look into as well. Those are some immediate things off the top of my head.
Now we're getting to our closing remarks here. Is there any way people can take action with you or learn more from you or get a part of your sphere of influence?
Yeah, so a few things. Number one is if you go to withumd.com, the one thing, it's with the letter U, MD, just so folks know, feel free to set up a consultation if you're interested in becoming a patient. And even if we can't directly help you, I'll do my best to point you in the right direction. So I would say that that's something to look at. And then, if you're a healthcare professional and just want great to network with great healthcare professionals. I'm starting to put on networking events in the New York area for healthcare professionals, so we can come together and come up with some solutions for some of these challenges we're seeing in healthcare. And the best way to reach me is just to contact me on my LinkedIn, and I can coordinate with you on that front.
Wonderful. And they can just find you at your LinkedIn with your name.
Yeah,
Very
exactly. It's pretty straightforward. I think there's a photo of me in a white t-shirt on my LinkedIn. Feel free to drop it in the show notes. That may be the easiest way to do it. I would just tell you what the URL is, but it has some ungodly letters and number googly goop on the back end. So just yeah, if you want to drop it in the show notes, go for it. And or if you just search Joshua Engel, Engle, comma New York in LinkedIn, I'm sure I'll pop up.
great. Well, I really do appreciate you reaching out and taking the time with me. We're small time still, so it really does mean a lot. It helps us get the word out there. I'll be putting stuff together for you. I'll be sending it to you. And if you ever come across new information or you have new things that you want to come on, you have my personal. We'd love to invite you back on to another call like this and give you the room to discuss these new whatever's happening because there's obviously a major problem in this space and we need to fix it. We need to fix it. God knows we need to fix it. Everyone knows we need to fix it. But how we fix it is a great question. So understanding this overall machine is going to help us, and that's why I'm glad we're having doctors, we're having patients come on here. We can understand these different parts of this machine, get a better understanding as how it all works together, and then we can go in and try to fix these momentary parts, these struggling parts, these decaying parts, implement it with new parts, find new technologies, whatever we got to do to fix it. And I know on the finance end, that's going to be our main focus. But with doctors such as yourself, finding new technology ways, making it easier for your patients to get access to you, and stuff like that. But again, we appreciate your time. Is there anything else that you would like to share before we end it?
No, I think we covered it. And thank you so much for the opportunity.
Thank you. All right, everybody. I appreciate you joining our call, and we look forward to seeing you in the next episode. Bye bye.
Bye.